Hi, my name is Valeria Santini. I'm the chair of the MDS unit at the University of Florence and Hospital Careggi in Florence, Italy. And I'm also chairing the Italian group for MDS. So finally, we have good news for our patients with MDS and for the treating physicians, of course, because we have two new drugs that can be used in the treatment of anemic patients with low-risk MDS. As you know, low-risk MDS are the ones that we follow for a longer time, and symptomatic chronic anemia is the main problem we have to face. And we had only erythropoietin-stimulating agents until now, and unfortunately, many of our patients, after having responded to the treatment, underwent to the transfusion regimens. So they need transfusions for a very long time sometimes because they have a relatively good prognosis or a longer survival. Now, having said so, the approval of luspatercept was already some years ago and was for patients with low-risk MDS and ring sideroblast and transfusion dependent. And in this setting, we obtain a response in patients who already received ESA or EPO, as you want to call it. And it was overall, for all the treatment period, around 47%. So a good transfusion independence, longer than 8 weeks. So maintained at least for 2 weeks, but also with a very good duration of response in a subset of patients, which is not negligible. So it was already a pace forward, but now we do have the approval of the luspatercept for patients who are transfusion dependent but not RS as well. And the great news is that you can use it in first line, meaning that in some cases in which a treatment with ESA is not appropriate because of high EPO, endogenous EPO, but also if they are ring sideroblast or SF3B1 MDS, then it's the first line treatment with luspatercept is giving really 60% response rate in terms of transfusion independence, this time measured for a longer time, 12 weeks, which makes much more sense for patients, and together with an increase of hemoglobin of 1.5 grams deciliter. So we are looking forward to new data. So maybe this approval will be, let's say, wider for a more subset of patients. So the first line is approved. First line luspa is approved both for RS and non-RS patients, and this is something very important and very interesting. So we have again another possibility for our patient. And a week ago, another drug was approved, which is imetelstat. Now, if luspatercept acts as a drug that is blocking TGF-beta pathway, imetelstat has a complete different mechanism of action, we think. It has still to be very well established, which is a competition, an inhibitory competition with telomerase. Having said so, what happens? Again, more than 40%, nearly 45% of patients treated with imetelstat can reach transfusion independence longer than 8 weeks. But the most important thing is that the durability of this response is really good and really long, because so 18% of patients overall, all the treated patients, 18% of them do have a response that lasts more than 1 year. So they are not transfused for more than 1 year, which is really a very important success. Now, imetelstat has some myelotoxicity that is manageable, but has to be taken into account. So when the drug will be available in large scale, we have to take this into account That means not treating patients who have severe thrombocytopenia beyond and beside anemia. And I think that these two drugs are really helping us to treat patients with chronic anemia. I hope that we will have new drugs coming. The experience is ongoing, so we will have hopefully some openings for other patients and with different characteristics, and mostly patient, we hope, patient with other cytopenias as well.